Current. This episode is focused on accountability and responsibility. Today we will follow a student nurse through 8 scenarios and try to identify where Nurse Paige went wrong. Each scene represents an indicator for accountability and responsibility, and here to help introduce each slide is registered nurse Jenna, who will help explain where Nurse Paige made errors and further discuss what we can do to better our practice and prevent reoccurrences. As we progress through the slides, you can pause the video to see on the slides why each indicator is important to nursing practice, and we will further discuss the scenarios displayed and answer the questions involved. Below are the 8 indicators of responsibility and accountability that we will be discussing throughout the course of the presentation, but first let's talk about what accountability is. Accountability can be seen throughout all aspects of nursing practice, such as ensuring and providing safe quality care, delegation, following and questioning policy and procedures, practicing within the guidelines of the Nurse Practice Act, maintaining confidentiality, questioning standards of care and providers' orders, alignment of care to organizational practices and philosophy, competence and clinical skills, lifelong learning, and patient advocacy. The first indicator that we will review is taking responsibility for our own nursing actions and professional conduct. Let's take a closer look at Nurse Paige as she comes onto shift at the hospital and attempts to help a patient out of bed for breakfast.
Good morning, Jane. It's time to get up for breakfast. Are you ready to get up?
I guess so.
Okay, I'm going to put your bed rails down. All right. Do you feel ready to sit up?
Yeah, I guess.
Okay, let's get up then. Okay, can you swing your legs over here for me? Okay. Nice job. Okay. Okay, let's sit up now. 1, 2, 3. Okay. Oh boy, do we need a few seconds?
Yeah.
Okay. Okay, time to get up. Oh no! Oh!
What happened?
I don't know! Her legs just gave out! It was the craziest thing I've ever seen!
Okay, now here to help identify some of the mistakes made by Paige is RN Jenna. Welcome.
Thanks for having me, Marla. Paige has demonstrated a common judgment error when assessing her patient. The first thing Paige should have done is start an assessment with a visual scan of her patient to see what her level of consciousness and orientation are. Paige was working too quickly and overlooked the physical and mental capabilities of her patient. When Paige sat her up, she should first see whether or not she can sit up on her own and maintain her balance and position, which in this case she could not. Paige encouraged her to work through her instability and get out of bed on her own, which is why she fell. Paige could have been hurt if the patient fell on her, or perhaps if she reached out to catch her and hurt her back. Lastly, when Paige's colleague came in to check on them, Paige claimed that her patient fell out of bed and did not take responsibility for her poor judgment. Next time, Paige should ask for help and perform a more thorough assessment before deciding what device to use to help transfer her patient for breakfast.
That's a great idea. The second indicator is functioning within its own level of competence within the legally recognized scope of practice and within all relevant legislation. Let's take a look at what Nurse Paige is doing now on her night shift.
Nurse!
Yes, Jane?
I need a pain medicine.
Oh, where does it
pain?
Where does it hurt?
All over.
And what's your pain scale?
Oh, 11%.
Okay, you hold still and I'll go get those meds.
Okay.
The doctor has no PRNs for 4 a.m. I wouldn't want to bother him. I'll just give it to her anyways. Coming, Jane.
Oh.
All right, your water's next to your bedside.
Okay.
Let's sit your bed up.
Okay.
Beep. Okay. Okay, now I will come and check on you again in just a little bit to make sure that pain's gone away, okay?
Okay.
Okay, you just lay still and get some rest. Call me if you need me. You know where your call bell is.
Okay.
Wow, the patient really sounded like she was in pain.
Yes, these situations are always difficult. In this scenario, Nurse Paige decided to give hydromorphone medication to a patient despite the fact that it was not prescribed to her. Each medical professional has general responsibilities that are within their scope of practice. Prescribing medication is not within a registered nurse's scope of practice. Nurse Paige should have called the doctor despite the fact that it was 4 a.m. and discussed what should have been done to help the patient. Functioning above your level of competence puts the patient in danger and is a serious offense. As a nurse, ensuring you are functioning at your own level of competence shows that you are taking your job seriously and shows you are responsible by understanding what you can safely do as a nurse.
Nurse Paige is very lucky no harm came to that patient. Anytime someone works outside of their scope of practice, they put their patient at risk due to lack of knowledge and training. Let's take a look at the next slide, which focuses on nurses assessing their practice and making improvements. Nurse Paige is in a rush, and she knows she has a lot to do in the morning. Nurse Paige has just come on to shift. She's done her safety check and is now doing vitals on her patient. She's checking O2, temperature, and heart rate. Now Nurse Paige is going to check the MAR for morning medications.
All right, Jane, I have you on top of the wall. Let's lift your bed. Beep. Okay. It's for your blood pressure. Your water's right by your bedside. All right, and I'll come back and check on you in a little bit.
Nurse.
Hey, how's it going? I've been having a really off day today. I just realized I went to my patient's room and didn't do the third medication check, and I didn't take their blood pressure before giving them their Metoprolol.
So what are you going to do?
Well, I spoke to my primary nurse, and I think I'm going to go reflect for a little bit.
Sounds like a good idea.
Wow, okay, so basically Nurse Paige was rushed. She forgot to take the blood pressure of the patient, which is a crucial component when obtaining vitals. Performing a head-to-toe assessment is equally as important, but vitals must be completed before administering medication so the safety of the patient is maintained. Paige gave metoprolol, which is a beta blocker used to treat heart and respiratory conditions. Also, she forgot her third check at the bedside, which can lead to major errors as administering medications to the wrong patient. I like that she thought about reflecting on her actions while she demonstrates a level of accountability, but in the future, Nurse Paige should have developed a plan to help prevent other mistakes.
Great points, Jenna. I think now is a good time to mention the importance of staying organized and keeping calm in times of chaos. If Paige felt rushed, she should have discussed this with her colleagues to see if anyone was able to help ease Paige's workload. Paige could also carry an organizational plan with her to help remind her of the order of care and hopefully prevent that from happening again. In our next scenario, Nurse Paige attempts to assist a patient who is in distress. The patient is clearly agitated. Let's take a look.
No, Jane, no, you don't. No, Jane, public place. We keep our clothes on. Let's get out into a chair. That will help calm you down. Okay, right over here. No, Jane, clothes stay on. Let's put these on for now. That will stop you. Yes. Nice job. Okay, keep our clothes on, and I'm just going to put this on you, okay? Quick, okay. And I'm going to give you some more Azepam. Okay. Good job. That's much better, Jane. Calm down.
This scene makes me sad, and it happens more often than you might imagine. It is easy to become frustrated or affected by someone's mood or behavior, but it's really important to remember what our role is. When someone is experiencing delirium or has dementia, or is perhaps just having a bad day, there is often a trigger for escalating behavior, and it is our job to observe possible contributing factors and attempt to eliminate them to see if this helps diffuse some of the patient's behavior. While it is a priority to help patients stay safe, it is also important to respect their space. What Nurse Paige did is not promoting safe and ethical care to patients. Chemical restraints and physical restraints are not always helpful and should not be used without consulting the patient and family. When Nurse Paige's responsibility was to provide the best care for the patient, and using restraints was not her responsibility.
Yes, very sad to see how often restraints are used despite the least restraint policies put in place. This next scenario shows the importance of developing practices that follow the standards of this profession.
Oh man, look at the time. I gotta get out of here for my dinner date. I think I'll just do the drag and drop for today. Her temperature was 37, but 36.5 is good enough. Yeah, that's about right. That one's right. And that one's right. Okay, there we go. Sounds good. Good work today.
Yes, the drag and drop technique. Definitely not something you want to become a habit. For those of you who don't know the drag and drop technique, it allows medical professionals to document for a patient by dragging information from what was last documented instead of adding in your own assessment findings. Nurses like Paige this causes a lot of issues for them finding as the findings are considered close enough to what the last nurse found, even if they're not the same at all.
Wow, that sounds like a real issue. Without putting in specific patient data, how do the nurses and doctors know if the patient is improving or not?
Exactly. That's the danger in this method. In order to be able to help patients, nurses and doctors need to do thorough assessments and documentation so that the following healthcare professionals know the steps to take if the patient's findings are out of a normal range. This method can be helpful to identify patterns, but it is tempting in times of chaos to speed through charting. In this instance, Nurse Paige should have taken the time to properly input all the patient's information instead of rushing off. Nurse Paige was not following the policies put in place to maintain professional standards.
I can see how that would be tempting, but it is very important to not allow this to become the normal way of charting. The next indicator is maintaining physical, psychological, and emotional fitness to practice. Let's take a look at how Nurse Paige is doing following this indicator.
Mrs. Smith, how are you doing?
Oh, not too bad.
Oh, that's good to hear.
I lost my husband last week, though.
Oh, how's everything going? So sad. I'm so sorry. How's everything going? My sister died 2 days ago.
Maybe we shouldn't have come into work today.
I think you're right.
This scenario is difficult because sometimes it's hard to identify within ourselves our need to take a break, or rather when we are not fit to practice. But it is imperative that we learn how to recognize and communicate our needs. This is important for our own mental health, but within the nursing profession, it's even more important to protect the safety of our patients. Practicing while unfit can mean working while both physically or mentally unprepared. This can put patients at risk and potentially lead to gaps in assessment, medication errors, miscommunication with colleagues, or even worse.
So what do you suggest if someone is feeling this way before or during a shift?
Good question, Marla. It is best to reflect and try to recognize one's fitness to practice before a shift, but that's not always realistic, and sometimes even during a shift can lead to inability to continue safely working. In this situation, communication with your supervisor is the next step. The nurse will then be supported by her team and union to take the time off and further develop a plan to return back to work.
That's good to know. Let's take a look at the next video that focuses on maintaining current registration.
Hey, any chance you can give me a hand in room 201?
Just 1 minute, I'm renewing my registration.
Oh, that reminds me. I need to do that too. Do you mind if I borrow the computer when you're done?
Yeah, for sure.
Nurse Paige did the right thing here by realizing that her registration was almost up and agreeing to renew it. She is keeping herself accountable and showing responsibility by knowing when to renew her registration and making sure it gets done.
Yes, she did exactly what she should have done in this scenario. This last indicator is about understanding the role of the regulatory body and the relationship it has to a nurse's practice. Let's take a look at how Nurse Paige does with this indicator.
Hey, Jenna, wait up. I really enjoyed that seminar that Fraser Health put on about PPE. It was a really good reminder on how to don and doff.
Yeah, it's so nice that they give us these refreshers every year.
I know.
In this slide, Nurse Paige and her colleague are returning from a Fraser Health seminar where they review the importance of donning and doffing PPE. These seminars are mandatory through BCCNM, the regulatory body, but are provided to protect patients by ensuring health professionals are keeping up with current standards. Breaking the chain of infection is the first and most important step in protecting patients and preventing the spread of the infection. It is nurses' responsibility to operate within these regulations in order to provide safe care.
Jenna, thank you so much for being here today. We enjoyed watching the videos and learning how to best care for patients while operating within a nurse's scope of practice. Responsibility and accountability are two extremely important elements in nursing, and there's much to be learned from Nurse Paige.